All right, discussion number 11, the 5-year-old boy who got bit in the throat by a stray dog. So based on the initial dispatched information, what problems might you anticipate regarding scene size up and the initial assessment findings? Well, as far as the scene safety and the scene size up goes, dogs can be pretty much in nice and not bad neighborhoods, but what kind of neighborhood am I going into? The main concern I'm going to have is the dog still somewhere around. Just because the dog ran off doesn't mean the dog doesn't live next door and isn't going to come back. Are there other dogs? A lot of times it's stray dogs. Well, at least my experience, they run in packs. There's not just one. And so we don't know where the dog's whereabout is. And do we have anybody who can handle the dog if it does come? Because we're not exactly about to jump on that dog. So the neighbors also were the one who saw him. My question is, are the parents there? Are the parents around? I mean, obviously we'll have inferred consent, so we'll still treat the kid and take him to the hospital, but we don't know where his parents are at this time because the neighbors were the one that saw him. Just because he's a 5-year-old kid playing out in the front yard doesn't mean mom and dad aren't passed out inside the house, or that they aren't all gone all together and that he's just hanging out. Or he's even in his house. I mean, I guess it says it's his own front yard, but we don't necessarily know that because, well, I guess the neighbors could verify that. Anyways, and so as far as the scene size up, the initial assessment findings, my concerns would be, and the difficulties we might have is the location of the bite. What is our circulatory, what's our bleeding? Do we have, did he hit a jugular? Did he hit a vein? Are we bleeding profusely at this point, or is it just, at this point, just some puncture wounds? Is it superficial? How hard did the dog bite down? Is there any crushing wounds on the throat? Has the airway been compromised? And if so, how bad? Is it something that we can treat? Or, a dog bite's not exactly like a cut or anything else like that. It could be gnarly, if I can use that word. So our airway management, torn tissue, is intubation going to be possible? And how are we going to get that airway? My other concern, and it's not exactly an initial size up, but does the dog have rabies? Do we need to have, and it's not that it's going to do anything at that very moment, but we need to get a hold of that dog to make sure that it doesn't have anything that's going to have other underlying issues that's going to cause problems for the kid later on. The second question is, why did this patient warrant rapid transfer to a trauma center? Well, mainly because with a dog bite, you're going to have puncture wounds if the dog bites down hard enough, and we're not going to know what kind of damage is done underneath the skin. We're not going to necessarily know just what it is going under there, and a lot of it we might not be able to manage. And so getting him to the hospital, again, where we see at the end, surgery was what was needed in order to fix his throat. And so getting him there so that the things can be done that need to be done in order to take care of what we can't see. We can manage the airway and keep him breathing, but those issues can be fixed, and weren't going to get better until they were fixed. So the other things, what critical interventions did the BLS quick response team members and paramedic provide to correct immediate life threats? We see BLS suctioning the airway to clear it so that he could breathe, an insertion of an oral airway so that they could maintain that patent airway, maintaining the spinal immobilization in order to protect his spinal cord, and also because of the possible fall and also the trauma with the lunge from the dog. And then the O2 will help with shock and also the lack of airway management. ALS, putting in the intubation tube because of the swelling of the throat, to maintain that airway when the possibility to maintain it was there. And also assessing the distal neurologic functions to make sure that there weren't any things going on, possible brain injuries from the fall. We don't know if he hit his head on the concrete. You get lunged and pushed down, it happens, and the kid passes out. And then finally, treatment priorities. We're going to be obviously making sure the kid can breathe, making sure that we controlled any bleeding, and then shock management and transport. So you get there, the kid, make sure that can breathe, make sure that he's not bleeding out, and manage that shock and get him to the hospital where a better, more in-depth assessment can be done through scans and different things like that. So